Good morning, everyone, and I welcome our esteemed speaker, Dr. Vikram Patel, to the session, which is the second session on learning and unlearning in the times of COVID-19. Much talked about subject, lots of negative news, lots of positive news, but this is a very different perspective we'll be hearing from Dr. Patel today on reimagining mental health to navigate a perfect storm. It's very interesting. I had a brief chat with the speaker today, and his topic is bringing about a new perspective to the COVID-19 and mental health, which is being looked at in a very different angle altogether. Before we go into the session, I would give a brief introduction of Dr. Patel. Dr. Vikram Patel is the Pershing Square Professor of Global Health and Wellcome Trust Principal Research Fellow at the Harvard Medical School. He also co-leads the Global Mental Health at Harvard Initiative. His work has focused on burden of mental disorders, association with social disadvantage, and the use of community resources for their prevention and treatment. He's a co-founder of multiple initiatives and organizations such as Movement for Global Mental Health, the Center for Global Mental Health, the Mental Health Innovations Network, and Sangath, which is an NGO based in India. He's an Indian NGO which won the WHO Public Health Champion of India Prize. He's also a fellow of the UK's Academy of Medical Sciences. He has served on the committee which drafted India's first national mental health policy and the WHO High-Level Independent Commission for NCDs, which is non-communicable diseases. He has been awarded also the Chalmers Medal, the Sangath Prize, the Pardes Humanitarian Prize, Honorary OB, and the John Doe Canada Gardner Award in Global Health. He was also listed in Times Magazine as 1,000 Most Influential Persons of the Year in 2015. With that, I hand over the forum to Dr. Vikram Patel to share his talk on the subject today. Welcome, Dr. Patel.
Thank you so much. So let me dive straight in. The title of my talk is very deliberately chosen. And there are two key parts to the title, which I hope to take you through. First of all, reimagining mental health, and secondly, the perfect storm. Let's start with the perfect storm piece. In order to understand the situation that India faces in terms of its mental health crisis that is going to follow COVID-19, one has to understand what was the situation before COVID-19. Before COVID-19, the government's National Mental Health Survey showed us that about 10% of all Indians met diagnostic criteria for one or another form of a mental health condition, which of course is a very wide range of conditions, ranging from autism and intellectual disability in childhood to mood and anxiety disorders, trauma-related mental health problems, alcohol and other substance use conditions, schizophrenia, bipolar disorder, and all the way through to suicidal behavior and dementia in old age. If you put all of those together, about 100 million people in this country were suffering from a mental health condition before COVID-19. And the National Mental Health Survey also showed us that about 85% of these people had received no care of any kind from any source for their mental health condition. Now, mental health conditions aren't only very important causes of suffering and disability, but they also kill. And they particularly kill in young people. For the past 10 years, we have known that suicide is the leading cause of death in young Indians. In fact, India is a suicide capital of the world in many ways. 1 out of every 3 female suicide deaths in the world occur in India, but India only accounts for about 12% of the world's women. And so India sees not only a very large burden of mental health problems, but also an enormous mortality associated with it. We also have very strong evidence from the country showing a relationship between social disadvantage, marginalization, for example, poverty, gender disadvantage, and poorer mental health. There are very strong associations between gender-based violence and suicide in women as one example of this association. So even before we actually had COVID-19, we had a mental health crisis. The government spends very little on mental health care, and the little that it spends is almost entirely spent on doctors, drugs, and hospitals. There is almost no real orientation of mental health to serve the plural and diverse needs of our population and to address particularly mental health problems from a community-facing perspective. Now we have COVID-19. In COVID-19, I would like to think about the issues of mental health in two periods. One, right now, while the epidemic is still upon us, and then looking forward, what is likely to happen in the months ahead. Right now, psychological distress is everywhere. And this is, of course, completely understandable. People are terrified of the virus. People are terrified of dying. People are terrified that their loved ones and their relatives might contract this disease. People are also terrified about the whole business of quarantining and physical distancing, of being isolated. People are terrified of breaking the rules. There are so many rules in India and so hard to keep up with them changing all the time. People are terrified because they don't quite know what is allowed and what isn't. Many, many people, hundreds of millions, in fact, in our country, are terrified about going hungry because they have simply lost their livelihoods over the last 8 weeks because the lockdown has meant that daily wage laborers are no longer able to earn money to put food on the table. These are not abstract anxieties. These are real everyday worries. And if one considers all of these factors, and of course to those I need to add domestic violence, which we now know has increased dramatically during the lockdown period, and the fact that many people with health problems, and by that I don't only mean mental health problems, but any health problem, have been unable to access the routine healthcare services because of the lockdown. If you put all of that together, it seems almost normative and expected that people are going to be very anxious during this period. In fact, I would consider this almost unexpected if you described yourself as being in great mental health. And it's extremely important to bear this in mind because one should be reluctant to medicalize this mental health reaction. This is a normative reaction to uncertainty and to worry about one's safety and one's future. How does one deal with this? Well, I'm very pleased to know that the United Nations Secretary General just yesterday released a brief that actually documents the mental health crisis that we're facing right now and provides, I think, very coherent solutions as to what needs to be done in the current. It is imperative that mental health actions are seen as integral and essential to all actions that are being done in the context of controlling COVID-19. A whole of government approach has many different pieces to it. For example, we need to consider mental health in national response plan across relevant sectors. And I'm particularly concerned, for example, for the learning needs that children and young people have because schools have been shut down. We need to respond proactively to the sorts of risk factors that are associated with mental health that we know are on the rise, such as, for example, domestic violence. We need to make sure that all routine healthcare services for all health conditions, but especially mental health conditions, are not interrupted because of the lockdown, because otherwise we're going to see a much increased rate of relapses. We need to support community action, not only to build social cohesion, to support those people who are going to be disproportionately affected by social distancing, for example, the elderly, but also to help our millions of migrants. I think those images of migrants walking the streets, of dying on the way, being run over by trains and trucks are harrowing. And they must touch every single Indian in our deepest cores. And I think it's extremely important. A whole of government approach means a whole of population approach, that each and every one of us shows solidarity with other Indians who are facing the most awful consequences of this pandemic, and particularly not the virus itself. Of course, that's the irony. It's about the policies that have been implemented to control the spread of the virus. And finally, I think we need to be very sensitive in how we communicate about the pandemic. I think the communication could have been much better. It has instilled enormous amounts of fear in people about dying, even though actually the vast majority of Indians who are under the age of 65, for them, this infection is mostly asymptomatic, which means you won't even know you have the infection. And even if you fall ill, the odds are almost 1,000 to 1 that you will come out of it in perfectly good health. And I think this idea of communicating risk accurately is something that we have totally failed to do. And I think we could actually correct that in the weeks and months ahead. While we think of mental health, we also need to be aware that not everyone is going to be affected in a similar way. There are certain groups in the population that we should be paying particular attention to. I'd like to single out at least 4 groups here. The first is people with a pre-existing mental health problem, and I already mentioned the importance of making sure that both the health and the social support systems for these persons is maintained. The second is health workers. Healthcare workers are naturally going to be much more anxious about their well-being because they're exposed to this infection every day. The third group is older people, both because they are much more anxious about contracting the disease, which is known to be much more dangerous in older people, but also because physical distancing leads to loneliness, which we know is it is a lethal problem in older people. And finally, young people, mainly because their entire lives have been thrown under the bus. Youth is the period when we make these critical transitions, completing education, finding a job, establishing interpersonal, intimate relationships. And all of these things have, of course, been totally disrupted by the pandemic. Also, young people is that age group in which we have the maximum incidence of mental health problems, and therefore we should be worried about a rise of mental health problems in this age group. But let's look forward. What's going to happen in the months and years ahead? And this is where I believe the perfect storm really becomes a good analogy. The last time we have faced such a calamitous economic recession was in 2008. But that recession didn't affect India very much. It affected mostly the US and a few other Western countries. This was, of course, the banking crisis. At that time, millions of Americans lost their jobs. And in the decade that has followed, there has been a falling life expectancy in the US, which has been wonderfully documented by the economists Angus Deaton and Ann Case in their book, The Deaths of Despair. In this book, they document the rising mortality in working age Americans, and they actually attribute this not to hunger, because these were people living in a country where people didn't go hungry in the same scale that we see in India, but because of the loss of hope, the loss of a sense of purpose in life. That's why they use the word despair, the deaths of despair, not the deaths of disease. And most of these deaths were driven by suicide and substance use, both alcohol and opiates. Let's turn the clock forward to where we are now, 2020. And the world is seeing an economic recession far, far greater than anything we saw in history. And India is profoundly affected by this. More than half of India's workforce, maybe even 2/3, has either lost their jobs or seen a profound decline in their income. And the thing here is that many of these jobs have disappeared forever or will take months or years to return. India shares many of the ills of America. These are two countries I know very well, and that's why I can speak about both together. India, like America, has profound levels of inequality. It has profound levels of social injustice. It has a very weak social security net and a completely fragmented and largely unaccountable healthcare system. But in addition, India, unlike the US, is home to the largest number of absolutely poor people in the world. Not just relatively poor, but absolutely poor. People who are earning less than the minimum that the World Bank has said is needed in order to actually eat adequately for yourself and your family. It is this toxic combination of absolute poverty with the calamitous economic recession that is looming ahead of us and the rising levels of inequality, combined with the very, very poor mental health care system that we have actually inherited before COVID-19 came, which really alludes to the perfect storm. Well, let's turn to positives now. India has seen many health crises, and this is not the first, and we have navigated many of them with remarkable success. But at the heart of this remarkable success has not been high-tech medicine. It hasn't been hospitals and doctors in white coats. It has been our communities, and in particular, our community health workers. And I want to really invoke the power of and the resilience of our community and our public primary healthcare system to think about solutions that lie ahead in addressing mental health care. Of course, there are others, but I really want to focus on this because whether it's been polio, whether it's been infant mortality or maternal mortality, the success that India has enjoyed has come from the grassroots health workers and its communities. India is, of course, one of the greatest laboratories for frugal innovations in improving access to quality healthcare and indeed a range of services, including education, in places where incomes are very low and money is very scarce. The community health worker is one of India's greatest healthcare innovations. And over the last 10 years or so, many organizations in India, but particularly Sangath, the organization that I work very closely with, has been a pioneer in demonstrating how community health workers can be trained and supervised to deliver psychological and social interventions for mood, anxiety, substance use related child and adolescent mental health problems. And of course, this is the bulk of mental health problems. And most of these mental health problems do not, in fact, have a pharmacological or medicine option. We've been successful to show the effectiveness of these approaches, and we've been working around the country with many state governments actually to embed these approaches within the public healthcare system. We are now currently engaged in working with the government of Madhya Pradesh, for example, in demonstrating how we can use digital tools to build a workforce, to extend the workforce out by using digital training and digital supervision. And of course, in the era of COVID-19, using such digital platforms is extremely important. And this particular initiative called Empower is one that Harvard Medical School is working with Sangath. And incredibly, we're using treatments, brief psychological treatments, for example, for depression, that were developed by Sangath and tested in India, and we're now transplanting those to the US. And of course, that's a wonderful and very rare example of reverse engineering, where frugal innovations developed in India are now being implemented in one of the most well-resourced and richest countries of the world. India has also been very lucky to have had tremendous political leadership, especially when it comes to mental health. And I must here draw your attention to the remarkable leadership that was done by Keshav Desiraju, one of our earlier health secretaries, under whose leadership India got its first national mental health policy and also got a Mental Health Care Act, which is a unique piece of legislation in India because it actually provides a legal entitlement for people with mental health problems to receive care. And here's the important thing. Both of these policy instruments entitle care in the community and through the public system. And where the public system can't actually deliver, it will be publicly financed. So this is a very important opportunity for us. Remember, we don't even actually have this kind of entitlement to healthcare for any other medical condition, but we have it for mental health. And this speaks really to the strong political consensus across all parties about the importance of mental health as not just as a health issue, but as a social development issue. I want to close now by just thinking about what we as a broader community of Indians should be doing to address mental health. It seems to me that this is a timely moment for all of us who are concerned with mental health, from mental health professionals and practitioners to civil society advocates, to unite with one message. And that message is that the COVID-19 response must address mental health alongside containment of the epidemic itself, or otherwise we will see an epic human tragedy unfold in the months and years ahead. We already know it happened in a country very similar to ours, the US, after 2008. And this time round, this economic recession is going to be a lot worse and affect a lot more people. But this is also a historic opportunity for us to completely reimagine what mental health care means. For us to actually acknowledge and embrace the plural and democratic ways in which mental health problems are experienced. They're not experienced purely in the form of biomedical disease labels and diagnoses, but also that people can recover in very diverse ways. And for this, we must go beyond narrow disease-based models of mental health care and embrace the diversity and the pluralism of mental health in our communities. Thank you very much.
Thank you, Dr. Patel. Thanks for a nice overview of what we have done and what has happened in the past, creating an analogy of the COVID-19 situation with a very different scenario, which is a macroeconomic situation of depression and how you need to deal with it. It was quite insightful to know that we were reeling in mental health issues. India has been a home to it, which has kind of compounded with the COVID-19 situation. Very well addressed about the fears, the anxiety that leads with fear. It's a fear of even fulfillment of basic needs for some people, which is food, shelter, fear of the unknown, fear of the death. And these are leading to certain actions we are seeing, which you have mentioned about the reverse migrants when they're reaching. And in turn, they are going to go through lots of mental anxieties when they reach their own home ground now. But happy to hear that there is a silver lining, and we have walked through crisis before, and we are going to walk through this crisis as well with a strong primary healthcare support system that we have, with the COVID warriors who are working relentlessly in the field. And there are lots of questions which is coming up, but it was overwhelming to know that Sangath is working on a digital platform in MP, and which has also been adopted for international use. Now that we are all shifting to digital platform, this is it's a new way of working now for all of us, which is actually the next session is all about the new thing. How do we work in a new way of working altogether? So the so-called new normal. So I would now take in the questions which has come. So there is a question on, just let me file it. Yeah. So how do we talk about, how do we address the health issues of our COVID warriors who are grassroots workers? How do we take care of those? Is something I would request you to address.
Hi. Okay, good. I couldn't unmute myself. Can you hear me?
Yes, yes. Doctor.
Okay, wonderful. So, I think the most important obligation, moral obligation for the government is to ensure, number one, that our grassroots and front, and actually all healthcare workers, this is true across the board, are adequately protected. And by protection, I don't necessarily mean you need these, these outfits that look like, they've come out of a Star Trek movie. First of all, even getting those is very expensive, but they're not even needed, except for people who are working in intensive care. I think what we really have to understand is that simple tools for a barrier protection of frontline workers in the form of masks, gloves, and good hygiene practices probably will protect the vast majority of them. But even those are unfortunately not always available, and people have to make do with, homemade sort of devices. The second thing is adequate information. I think this information about risk is so very important. Most of our health workers are young people who are not, the average age is between 25 and 40. These are, most of them are women, actually. That's the other important thing. COVID-19 has shown a gender bias. It is much more lethal for men, older men in particular, which is, of course, a completely different demographic to our health worker. So I think we need to be able to convey the truth of risk to our female health worker army, more than 3 million of them in this country, and deploy them to do what is essential right now, particularly as the lockdown is being lifted, which is to identify cases proactively, not needing expensive diagnostic kits, but just identifying people on the basis of symptomatic conditions, and then supporting them in home isolation and doing the contact tracing. And so protecting our health workers, providing them with accurate information. And then I think, to be honest, we also need to be recognizing the mental health burden on them. And so providing support for the health workers using the well-established psychosocial intervention that Sangath has designed would be obviously the third important piece in the entire mix.
Thanks, Dr. Patel. You just touched upon the work of Sangath in the space of digital platform, and confident that being an NGO for so long, working in this space, there is more that's happening. So if you could share a little bit more, how Sangath is involved in this space, especially in context of the pandemic that we are facing?
So, the pandemic, of course, overtook us. We were already working in this space for more than 2.5 decades. But the digital platform that I want to emphasize is two kinds. The first is a digital platform to train frontline workers. One of the greatest barriers, even before COVID-19, to getting these brief psychological interventions out was that the model to train and supervise was very resource intensive. It required the health worker to come to a space for 7 to 10 days. That means that health worker had to leave their families, they had to leave their routine work that they were already doing. But at the same time, you needed to have an expert who was able to take all that time off to actually train them. You put the two together and you realize that this is impossible in terms of the cost model to scale up to the whole country or indeed the whole world. So Empower is really a digital platform that's using the latest science of digital learning to convert the entire curriculum into video-based curricula, to then use competency exams that are well validated, and then to use digital platforms for support and supervision, so that effectively, once you develop the content, you can train all of India's health workers within a matter of a few months. And that's what we've done with depression. We've already digitized in Hindi the curriculum for a brief 6-session treatment for depression. That's already being tested in a trial right now in Madhya Pradesh. And we're hoping with adequate funding that we can now extend that to maternal depression and to the state of Gujarat as well.
Thanks, Dr. Patel. So there are various segments of our society who are facing depressions in various degrees. For example, starting with school children, their whole socialization pattern has changed. School is not happening, it's gone digital, they are not able to meet friends, so they are going through certain kind of fears and anxieties and mental health problem. If I look at the degree, the biggest degree is with the migrant laborers. The kind of mental traumas they are going through and also importantly, the patients who have recovered from COVID-19, they are also going through certain mental health. So just as an example from these three, if you could share with us that how would you recommend that they deal with it? What are the various ways and strategies to do so?
Sorry, you got cut out there. So who would deal
So there are three segments if we take. There are many segments. If we look at the school children, their mental health issues, migrant laborers, where the degree of mental health is to the level of trauma, and the patients who have recovered from COVID-19, they are also going through certain mental health issues pre, during, and post. So if you could share briefly with us, how would you recommend them to deal with it?
So the first thing with kids, I think we have to very, very quickly return children's lives to normal. I think we need to reopen schools as soon as possible. It isn't good enough just to move education to Zoom. Only 10% of India's households have streaming internet access. It's an absurdity. And also it's very important to remember that schools are not only to go learn mathematics and geography, they're also places where children learn how to socialize. And this is a profoundly important experience in terms of the development of the child's brain and maintaining their mental health. So I think return to school as soon as possible is the most important initiative. For young people, I think the stress can be also managed through teaching young people problem-solving skills. So one of the other innovations that Sangath has is a digital game-based problem-solving app, which in fact we're currently about to roll out in Goa. And so using life skills, building life skills in young people through curricula as well as extracurricular interventions to build problem-solving skills would be a really great example of a mental health promotion intervention. For migrant workers, I think access to livelihoods is probably the most effective mental health intervention, not a clinical one. But of course, at the same time, we must also address people's mental health problems. It isn't only sufficient to ensure that people are not going hungry at night and have a job, but also that a huge number of people will be clinically depressed. And I think for them, these brief psychological treatments that I mentioned earlier is by far and away the most effective intervention. And finally, for people living with COVID, the important thing is a post-COVID recovery counseling. And I don't think we put enough attention to this. We just discharge people and send them home. But clearly, you're absolutely right that there is a kind of a terrifying and frightening experience, not so much just because of the infection, but also all the anxieties about being quarantined and how all the members of your family will also have to be quarantined. All of this also has an enormous impact on your mental health.
Thank you. Thank you, Dr. Patel, for your time. Thanks for the lovely morning. Thanks, audience, for being there and being so proactive in asking questions, which actually helped me to carry on the conversation with the speaker. Thanks a lot. I will hand over the session now to my colleague, Dr. Shailendra Hegde, who will be taking care of the next session, which is on new normal. Request the audience to continue being here while we log out. So Dr. Patel, have a nice day. And thanks for being with us.